NCLEX bow tie question. This is what a bow tie question looks like on the next generation NCLEX. You have to choose a condition the patient is most likely experiencing. Then you choose 2 action items to take. Step 3 is to choose 2 parameters to monitor. But first, let's read a little bit about our patient. The nurse is caring for an adult client in the clinic. First, let's look at the nurse's notes. The client presents today for an evaluation of a reddened, painful, and inflamed left breast. Client reports giving birth 3 weeks ago to a healthy infant. Client reports that the infant nurses every 2 to 3 hours and doesn't feel like the baby receives adequate supply of milk. The client's breast is red with purulent drainage and painful to touch upon examination. Client is tearful and reports, "I don't know what's wrong with me and this hurts so bad. I think the baby is always hungry because of whatever this is." Client denies any previous medical history or medication use. Reports pain at 7 out of 10. A little tip for bow tie questions is to scan and skim the information given. There may be even longer paragraphs to read. It's important to note those abnormal findings and recognize the cues. Let's highlight some abnormal findings. The client has a reddened, painful, and inflamed left breast. The client's breast is red with purulent drainage, and it's very painful. She also feels like the baby isn't getting adequate supply of milk. So those are some of the cues, the things that you should really be looking out for, those abnormal signs. Now let's go to our vital signs. As I'm skimming these here, I quickly recognize that this mother has a fever. A temperature of 101.9 Fahrenheit is considered a fever. Again, she's also rating that 7 out of 10 pain. All right, let's answer our question now that we know a little bit about our patient. The next tip about bow ties is don't think of this as one huge question. It's less intimidating to break it down in your mind. So think of it as 3 parts, just like answering 3 different multiple choice questions. First, we pick the condition we think our patient is most likely experiencing. The first option is a cyst. Cysts present with lumps or masses that can be palpated, and the client doesn't report any of these symptoms, so that's not the answer. Second one is mastitis. Mastitis is an inflammatory condition that often presents in lactating women with symptoms such as erythema, pain, tenderness, and drainage with a possible infection. This kind of sounds like our patient, but let's keep reading. Next one is ductal astasia. This is generally painless, but can be accompanied by burning, itching, and swelling. And sometimes the discharge may be bloody. If this is painless, it definitely doesn't explain our patient because our patient is experiencing severe pain. Next is fibroadenoma. This is multiple small, painless, mobile masses and doesn't present with discharge. This doesn't really sound like our patient either, again, because we have pain and we have discharge, making the best answer mastitis. All right, next we do 2 actions to take. The first option is apply moist heat to the left breast. Moist heat is used to decrease pain and improve circulation to the affected area, so this absolutely would be a great action to take. Next option is transport client to imaging for a mammogram. Well, there's no indication for the use of a mammogram with mastitis, so this isn't the option. Next option is to teach the client to take cold showers. The client should be instructed to take warm showers. This decreases pain and it also increases milk production prior to breastfeeding. So this is definitely not our action to take. Next option is provide lactation therapy. Lactation therapy on how to breastfeed with mastitis should be provided to this client. What happens is many women stop breastfeeding due to this condition, so we absolutely want to provide lactation therapy. But we should look at all of the options to be sure. Prepare the client for surgical excision. This client doesn't need any surgical procedures for mastitis. Okay, lastly on our parameters to monitor. The first option is milk production. The nurse should monitor the client for increased milk production, which often is decreased, like the patient said, due to the inflammation from mastitis. So we definitely want to be monitoring that milk production. Next one to monitor is pathology. The client doesn't really need a biopsy for mastitis, so no pathology will be needed for this client. Next is FSH levels or follicle stimulating hormone levels. These aren't really necessary to be monitored for this condition. Now, certain breast cysts can cause abnormal FSH levels, but mastitis does not directly produce these results. Next is body temperature. The client's body temperature absolutely should be monitored. Right now, the patient has a fever, so we want to make sure that this resolves, again, not leading to an infection. Color of discharge. Now, this might seem like the answer to you, but the color of discharge is not a priority. The discharge should resolve after the use of antibiotics to get rid of the infection.